And today what I want to talk about is what happens after an automobile accident. A lot of our patients that we see here are as a result of some form of trauma. Sometimes it's just normal wear and tear, but a lot of times it's as they had a sports injury, a slip and fall, or they got hit by a car. What happens 9 times out of 10, you go to the hospital, they take x-rays at the hospital. Hopefully they take x-rays at the hospital. You got to understand the emergency room is looking for emergency types of cases, meaning are there any dislocations? Are there any fractures? Anything broken? Anything major there that they actually need to escalate this to? If it's just a subtle bone misalignment, they're not going to necessarily consider that an emergency condition, and in that particular case, for emergency room, it's not. But it doesn't mean that it's not causing you pain. It doesn't mean that it can't create a problem that turns into a bigger problem like arthritis or degenerative changes over time if it doesn't go addressed. No matter if you're young or old, compact collisions or these types of traumas can create a lifetime worth of injury. This x-rays that I have up is a young man that's less than 25 years old, and we're going to go into what I'm looking at as far as nuances. If he had taken this x-ray at the hospital, they would have looked at this and said, not a problem, I don't see anything broken or dislocated, you're fine, here's a prescription, go home. However, I'm looking at the young man's pelvis. So what you see is, so first let's talk about what the low back is and what the pelvis is. 9 times out of 10 patients come in, they really say, well, I'm having low back pain, but a lot of times it could be pelvis pain. In this particular condition, this particular case is the same. So I'm looking at his pelvis, and this could easily go missed, but he's having a lot of discomfort, a lot of low back stiffness, and if you're under 25 years old, you don't expect to have this type of pain. So you know it's related to the accident. But what I want to point out is what's going on with the pelvis. This being the right hip, this being the left hip, where that joint comes together is called the SI joint. Right here is the left SI joint, and you can see that SI joint pretty wide open. Hip coming into tailbone right here. But what we see when we look at the right side is a joint that's jammed. It's jammed and you're losing space between the joint. That to me, for someone less than 25 years old, suggests that he's going to have early degeneration, a condition that can continue to get worse, especially if you're sitting down for long periods of time, if you're doing any type of manual labor, and if you're not getting this adjusted and treated. This pain will start to develop into hips, create muscle weakness, and also create pain that can radiate down the leg, usually up to the knee. So the point for today is looking at x-rays, going to the hospital, even if they say nothing's broken or nothing's dislocated, doesn't mean you're out of the woods and doesn't mean that you don't have a problem. Because this, in my opinion, is something that we're definitely going to have to correct and fix. We look at his low back from the side view. It's not too bad. He has good space between the bones, but the curve for the low back is just not there. Usually that's, again, can be a response of trauma or spasm. Going to his neck, the same thing. This is actually a little bit worse than the low back. We have 3 distinct curves in our spine. We have the neck curve, which goes like this. We have the mid-back curve, which goes reverse of the neck, and the low back curve. How about this? We have it right here. The neck curve, the mid-back curve, and the low back curve. A sign of whiplash is that you lose your natural curve. So the curve like this turns into a reverse curve. Instead of going back this way, it now is going reverse. This is an important take-home message. Not only do people have what we call reversal of curves after accident is common with whiplash, but with technology and everybody keeping their head down, we see a lot of reverse curves in these cases as well. The problem with having a reverse curve, especially if you get it at a young age, is what's happening to the disc in between the bones when you have that reverse curve. That curve is there to maintain the proper pressure along the spine. Now you have a curve that's going in the opposite direction. It's going to put a lot more pressure on the disc. Those discs are going to wear out or be vulnerable to a herniation. A herniation, just so that most people are familiar with a hernia. I had a hernia, which means the inside of somewhere in my abdomen is coming outside of my muscles. Same thing with a disc herniation. It means that the inside of the disc is coming outside of the containment of the disc. It's herniating out, and it can cause pressure on nerves, they can cause a lot of problems. It causes radiating pain, radiating down the arms, radiating down the legs. But one of the first signs that you are susceptible to a disc herniation is a reversal of the curve. So again, if you've been injured in an accident, you may not even be feeling a whole lot of pain. You may have gone to the ER doctor may have told you you don't have anything broken, you don't have anything dislocated, and you say, okay, you go home and you don't get any treatment. When in reality, you're dealing with issues that can turn into a much bigger problem later. Show you one last x-ray, and this is this same gentleman when he's actually trying to put his head forward. When you bring your head forward, because he has the reversal curve, he's not going to have the same amount of range of motion that he should have when leaning his head forward, again causing stiffness around the neck, causing headache symptoms for a lot of people, but more than anything else causing decreased function and pain. You have a problem sleeping at night now, you have a problem concentrating because these symptoms are causing a problem. So if you have questions, please post your questions, please like the page. We love to give information, we love to get responses from you to hear what you think about this and what you may have a question about regarding chiropractic care. Again, Dr. Goldson at Goldson Spine, where we turn up the life.